stroke and antiphospholipid syndrome. Antiphospholipid antibodies are a risk factor for an ischemic cerebrovascular event. Via latest results for clinical rheumatology. Abstract. Testing for antiphospholipid antibodies could be an important part in determining the cause of a cerebrovascular event, CVE. Currently, it is also unknown whether antiphospholipid antibodies represent a risk factor for the development of a CVE and whether the selected therapy options are efficacious. So, this study aimed at 1. Determining the frequency of patients experiencing a CVE and fulfilling the laboratory criterion for an antiphospholipid syndrome, APS. 2. Investigating whether the persistent presence of antiphospholipid antibodies represented a risk factor for a CVE, and 3. Focusing on the efficacy of the selected treatment strategy in the first year after the CVE. 89 patients with an acute CVE were prospectively followed for 1 year. At least 2 sera from each were tested for lupus anticoagulants, anticardiolipin, anti-beta-2 glycoprotein I, anti-phosphatidylserine/prothrombin and anti-annexin V antibodies. 20 out of 89, 22%, of CVE patients fulfilled the criteria for APS, 17-20 for definitive and 3 for probable APS. There was a significant association between persistently present antiphospholipid antibodies and the CVE, or 4.62. No statistically significant difference was found in the CVE recurrence rate between APS-CVE and non-APS-CVE patients being treated mainly with acetyl salicylic acid. Antiphospholipid antibodies represent an independent risk factor for a CVE. In the first year after the CVE, antiplatelet therapy seemed to be sufficient in secondary CVE thromboprophylaxis in most APS patients. ADTAGs, currently, #medicine by Alexandros Sfakianakis, Rheumatology, #ola by Sfakianakis G. Alexandros.